All right, today we're diving into something that's, well, it's responsible for 1 in 5 deaths across the entire globe, yet it often just hides in plain sight. We're talking about sepsis. And to really get our heads around it, we need to start with a pretty unsettling question.
Just think about this for a second. What if the very system that's designed to protect you, your own immune system, what if that was the thing that turned against you? I mean, that is the terrifying core reality of sepsis.
And the scale of this problem is just staggering. According to the World Health Organization, 1 in 5 deaths worldwide are linked to sepsis. Let that sink in. Not 1 in 5 deaths from infection, 1 in 5 deaths, period. That's 20% of every person who dies on this planet. And the crazy part, as we're about to see, so many of these deaths could be prevented. Okay, so to figure out how we fight it, we first have to really understand what it is. How does a totally normal infection suddenly escalate into a full-blown, life-threatening crisis? And this right here is the absolute key point. Sepsis isn't the infection itself. No, it's the body's catastrophic overreaction to the infection. Your immune system, trying to do its job, just floods your body with chemicals to fight the invaders. But this response goes haywire, triggering massive, widespread inflammation that starts damaging your own tissues and organs. Yeah, this lays it out perfectly. It all starts with just a common infection. But instead of a targeted, precise fight, the immune system basically goes nuclear. It's a total overreaction that leads to this out-of-control inflammation. And that inflammation, it messes with your blood flow, effectively starving your organs of the oxygen they desperately need to survive. And what's really frightening is that this whole dangerous cascade can be kicked off by incredibly common stuff. We're talking about things like pneumonia, a urinary tract infection, or appendicitis. Heck, even just an infected cut on your skin can be the starting point for this whole life-threatening mess. Okay, so now that we know the danger, we get to what is probably the most important part of this whole thing, how to actually recognize the warning signs. Seriously, this is the knowledge that saves lives. So here is what makes sepsis so incredibly tricky to spot. Early on, it can feel just like the flu or some other bug. You've got a fever, you feel weak, but the red flags for sepsis are way more extreme. We're not talking just a fever. We're talking extreme shivering or muscle pain. Not just feeling weak, but sudden confusion or disorientation. And you absolutely have to watch for rapid breathing and that cold, clammy, or even blotchy-looking skin. Those are the critical differences. All right, so let's really lock these in. A high temperature, or weirdly, a very low one, a racing heart, breathing way too fast, confusion, extreme weakness, and that really telling cold, clammy, blotchy skin. If you see this combination of things, especially in someone who already has an infection, your alarm bells have to be ringing. You have to ask yourself, could this be sepsis? And if you do suspect sepsis, you have to act, and you have to act fast. Because there is simply no other way to put this. You are in a race against time. And listen, that isn't just some dramatic phrase we're using. It is the literal, fundamental truth when it comes to treating sepsis. The numbers here are just, you're unforgiving. For every single hour that treatment is delayed, the risk of death goes up by about 8%. Just let that sink in for a moment. Every 60 minutes that passes, the danger gets that much higher. And this timeline, it makes that abstract number terrifyingly real. Look at this. After just 4 hours of delay, the mortality risk has already jumped by more than 30%. The window to actually step in and make a difference is incredibly, incredibly narrow. But the good news is, there is a clear plan of attack. In hospitals, they use a protocol called the Sepsis 6. It's a set of 6 critical things they do, all within the first hour of spotting sepsis. We're talking about giving oxygen, getting IV antibiotics in right away, taking blood cultures to find out exactly what they're fighting, and just generally supporting the body's systems. It is a proven lifesaver. So if we have this clear plan, why is sepsis still such a massive problem? Well, in our final section, we're going to look at exactly that, the challenges we face and the really hopeful new solutions that are changing the game. So what's standing in our way? Well, a lot of the biggest barriers are things we've already touched on. Those early symptoms are just so vague, so easy to dismiss as just the flu. Not every hospital has the same screening process in place. And maybe most importantly, a simple lack of awareness means people often wait way too long to get help, just not realizing the extreme danger they're in.
But here's where things get really hopeful. Technology is giving us a powerful new edge. We are shifting from a world where it took days to figure out what bacteria was causing the problem to a world with rapid tests that can give us answers in a matter of hours. We're moving beyond just looking at broad symptoms to using specific biomarkers in the blood. And now we're even using AI algorithms to automatically flag patients who might be at risk way earlier than a human ever could. But for all of that incredible technology, the single most powerful tool we have isn't in a lab. It's awareness. It's the knowledge inside your head, my head, inside the heads of paramedics, nurses, and doctors to recognize the signs and simply ask that critical question: could this be sepsis?
So now you know. You know what to look for, and you know exactly what's at stake. The only question left is the one for you. Now that you know the signs, would you act in time?